السلام عليكم. Ready? الو.
وعليكم السلام دكتور. نعم.
يعني الشاشة واضحة؟
ظاهر الشاشة موجودة.
تمام، يعني شكرا. إذن we will start with the second lecture, and this is the last lecture in UGS for you in microbiology. And this is again the last microbiology lecture for you. We have started from the second year and we continued up to the systems, and this is the last lecture إن شاء الله. السنة القادمة تبدأون بالكلينيكال. Gonorrhea، مرض السيلان. You remember when we have talked about meningitis in CNS1, we have spoken about Neisseria meningitis. And I told you that we are going to speak about Neisseria gonorrhoeae or gonococci with the UGS. So we are going to talk today about Neisseria gonorrhoeae in relation to the UGS as the commonest cause of sexually transmitted diseases. We are going to talk about laboratory diagnosis, pathogenesis, susceptibility to antibiotics, and also epidemiology of gonorrhea. Remember, the disease is called gonorrhea. The microorganism called Neisseria gonorrhoeae. Okay? Gonorrhoeae. You should not say Neisseria gonorrhea. خطأ. Neisseria gonorrhoeae. While the disease is called gonorrhea. Just for simplicity, we call them gonococci. مثل ما نقول streptococcus pneumoniae. Sometimes we say pneumococci. Here also Neisseria gonorrhoeae, called for simplicity an old name, gonococci. Neisseria gonorrhoeae, gram-negative diplococci with opposing sides flattened together, kidney bean-shaped appearance, similar to what I have described to you with Neisseria meningitis. They can grow on chocolate agar because fastidious microorganism. They require nutrients. They require CO2, 5 to 10%. They produce small, smooth, non-pigmented colonies, and we will see a picture for that. This microorganism has got numerous villi for attachment. The outer membrane of the microorganism contains phospholipid, lipopolysaccharide LPS, lipo-oligosaccharide LOS, and outer membrane proteins, which can be porins POR1BA and POR1BB. Also, the microorganism has got OPA antigen. OPA, we have 12 OPA. These are adherence antigen. OPA, it has been derived from the word opaque. The colony is opaque, يعني مو شفافة، شوية داكنة. Opaque. So the outer membrane contains all of these substances, and we will come to opaque also in a moment. We will come back to it. These are the, this is urethral discharge. You can see the microbe intracellular. When these neutrophils, these are neutrophils, break down, the microorganism will be released, become extracellular. To diagnose gonorrhea, you should see intracellular microorganism inside the polymorphonuclear leukocytes. And the microorganisms are diplococci, gram-negative. diplococci. You can see them gram-negative. The antigens or antigenic variation, this microorganism characterized by variation in the antigens. Variation in the pili, in the OPA, in the LOS, lipo-oligosaccharide. Pilla, the antigen is called pillin and controlled by gene, pillin genes, either expressed or silent. The PILE, يعني expressed, or silent S, pill S. This is the pillin gene which control the pili. OPA, opaque, on and off genes. مرة يظهر مرة لا يظهر. It depends on the environment. Lipo-oligosaccharide genetic mechanism is unknown. How it is controlled is unknown. This microorganism, why doing this variation? ليش هذا الاختلاف? Silent to expressed, on or off. For what? To escape from immune response. To escape from immune surveillance, التفتيش المناعي. Antibody bind to the predominant strain, and this will lead to antigenic variation. راح أشرحها لكم كيف. So this is the pili, how the Neisseria attached to surface membrane with the pili. Look, this is the variation how it occurs. These are Neisseria, gonorrhea with the blue pili. And here there is a minor group has red pili. Antibodies against the blue one will cause a clumping of this predominant strain. All will be killed. يبقى عندنا the red one. The red one now will take over and become a predominant. إلى أن تظهر أخرى which has a green color. Now the antibodies will bind to the red ones and leave the green one, which will propagate again, and then another mutation can occur. So this is the way of the variation of gonococci. Epidemiology of gonorrhea, now gonorrhea disease. Gonorrhea is one of the greatest public health problem. مشكلة صحية كبيرة. Mainly it occurs in adolescents because these people are sexually active. The problem in the diagnosis, in women, 50% of women are symptomless, asymptomatic. ما تعرف أنه هاي المرأة مصابة. 50%, half of them. And another problem, resistance to antibiotics. في strains very resistant. وهذا يساعد على انتشار المرض. This microorganism can be acquired by sexual contact. There is a chance, if there is contact with a patient, 20 to 50% that the individual will get the disease. Also, you have to remember that there is non-sexual transmission via toilet. يعني مريض يستعمل تواليت يجي شخص آخر سليم ممكن ينعدي ولو هذا rare possibility. Pathogenesis, attachment by what? By pili and OPA. Mediator of attachment to non-ciliated epithelium via receptors. شو هي الريسبتور؟ CD46, CD66 and integrins. هذه وين موجودة؟ على الابيثيليال cells. فإذا البيلاي والأوبا يجوا يعملوا attachment مع CD46, CD66 and integrins. outer membrane proteins اللي حكينا عليها for 1BA trigger enzymatic activity, phagocytosis and cell invasion. انتوا تذكروا من حكينا عن نيسيريا meningitis تدخل داخل الابيثيليال cells, migrate through it, and then appear in the submucosa. Because Neisseria meningitis is capsulated, it can resist phagocytosis and can invade the blood vessels and go to the bloodstream. This microorganism, Neisseria gonorrhea, is non-capsulated. Non-capsulated microorganism, so they will stay mainly at the submucosa. Rarely invade the blood, rarely invade the blood. Survival in the submucosa, they can scavenge iron. تصطاد الحديد، تأخذ الحديد. These are not capsulated, as I said, but has lipo-oligosaccharide, which binds sialic acid on the epithelial cells. And this will lead to binding to factor H and the blocking of C3b. هذه complement component. factor H عارفين انتم من الاميونولوجي تبعكم، و C3b عارفين. فإذا ال LOS has capability of blocking factor H and blocking C3b. من يصير عندك blocking لل C3b يصير block للفاجوسايتوسيس. Also, the microorganism is resistant to killing inside the phagocytic cells. شفتوا النيوتروفيلز تبقى الميكروورجانيزم داخلها. Spread and dissemination. الانتشار. اليوم كثيرة كلمة dissemination. Local spread, it occurred to the epididymis in males and fallopian tubes in females. And also we will talk in details about this point. Lipo-oligosaccharide and peptidoglycan shedding can cause local injury, for example, to the urethra. Very rarely reach to the bloodstream, which is called disseminated gonococcal infection, DHI. What is DHI? Disseminated gonococcal infection. يعني من النادر ما تروح الميكروورجانيزم to the blood. Immunity antibody response is weak. وعندنا مشكلة الإيش؟ الانتيجينيك variation اللي حكينا عليه قبل شوي. فإذا antibody response is weak and we have antigenic variation which make the immunity not solid. Capsule. In contrast to meningococci, gonorrhea is localized to mucosal surfaces, rarely go to the bloodstream or deep tissue, acquired by sexual contact. Manifestation will be as pain and purulent discharge from the urethra. Remember, the patients will come to you, doctor, I have got urethral discharge. In men, the urethra is affected. In women, the cervix is affected. Direct extension from the cervix go to the fallopian tube and can produce fever and lower abdominal pain, which is called pelvic inflammatory disease, PID. راح أرجع على PID أشرحها لكم بالتفصيل. And this PID may cause sterility, العقم, and may cause ectopic pregnancy, الحمل خارج الرحم, لأنه الفالوبيان tubes will be blocked. Clinical manifestation in men. Primary site, urethra. So there will be urethritis. Start 2 to 7 days after infection. It means an incubation period is between 2 to 7 days. The patient will have purulent urethral discharge and dysuria, painful urination, Purulent urethral discharge يعني زي القيح. The patient may have epididymitis, prostatitis, which are uncommon. In female, the primary lesion is in the endocervix. The patient will have vaginal discharge, urinary frequency, dysuria, abdominal pain, menstrual changes. Mild symptoms is common, and we said that 50% of women are symptomless, which make diagnosis difficult لأنه ما تجي تراجع. Also, there may be rectal gonorrhea, again symptomless, and the patient may complain of tenesmus. What is tenesmus? Is the need to go to toilet to pass a stool in spite of empty colon. Also, there may be discharge and bleeding. Rectal gonorrhea. Pharyngeal gonorrhea, symptomless, sore throat, cervical adenitis, lymph node adenopathy. Ophthalmia neonatorum. Ophthalmia neonatorum. هذه هي الصورة مع الأوفثالميا neonatorum. Ophthalmia neonatorum. Severe acute purulent conjunctivitis. يعني تملي العين، هذا الجفن شوف مغلق، لو تفتحها هالشكل pus gush will appear. Acquired during childbirth from the mother. If the mother has got gonorrhea, infection of the cervix, for example, and during labor the child passed through infected cervix and vagina, will develop ophthalmia neonatorum, which can lead to blindness if not treated, if no treatment is provided. Pelvic inflammatory disease, PID, شو هو ال PID? Develop in 10 to 20% of women with gonorrhea. The patient will have fever, abdominal pain, usually bilateral, tenderness, leukocytosis, infection. The patient may complain of salpingitis. What is salpingitis? Salpingitis is an inflammation of the fallopian tubes. لو واحد يسألك شو هي salpingitis? An inflammation of fallopian tube. Pelvic peritonitis, abscesses. Usually gonorrhea is associated with infection with the chlamydia trachomatis and other anaerobes. لهذا السبب when you test for gonorrhea, you should test also for a chlamydia trachomatis. Again, this can lead to infertility, العقم, and can lead to ectopic pregnancy. ليه ectopic pregnancy and infertility? The fallopian tubes will be blocked, will be fibrosed. There will be strictures, انسدادات. This picture summarizes to you the male gonorrhea and the female gonorrhea. In the female, we start with the female, 50% asymptomatic. تمام؟ نشوف هذا asymptomatic. It could be present as cervicitis and urethritis. Local complication as peritonitis. May lead to sepsis and dissemination to the blood, DGI, disseminated gonococcal infection, which will appear as rash, meningitis, endocarditis, arthritis. In males, usually, mainly, it comes as acute urethritis. Some of them will be asymptomatic, but not as much as in the female, 50% in the female. Here, minority. There may be local complication like epididymitis. Maybe sepsis also spread to the blood and cause disseminated gonococcal infection, rash, meningitis, endocarditis, and arthritis. Clinical manifestations, different tissues can be involved, but the main ones, urethra, purulent discharge, maybe scanty discharge, dysuria, painful urination. In the cervix, red cervix os, purulent discharge, dysuria, salpingitis, bilateral or unilateral lower abdominal pain. Also rectum. This is due to abnormal sexual contact, copious purulent discharge, burning sensation, stinging pain, tenesmus, wants to go to toilet but empty colon, or blood in the stool, pharynx, mild pharyngitis, sore throat, erythema, conjunctivitis, conjunctiva, purulent discharge, keratitis. Keratitis is an inflammation of the cornea, corneal ulceration, perforation, extrusion of the lens, بروز عدسة العين تطلع من مكانها. Scarring or opacification of the lens may lead to blindness. This is gonococcal pharyngitis. This is ophthalmia neonatorum, as I have described it before. This is the Tubo ovarian abscess. This is the fallopian tube. This is the uterus. Look to the abscess. Big abscess here. Diagnosis, we do gram stain. Bean-shaped, gram-negative diplococci inside the neutrophils, intracellular. This gram stain is 90%, 95% sensitive in men. يعني فحص جيد يشخص 95% من الرجال المصابين. However, in females, less, 50% to 70%. So we cannot depend on a gram stain solely بالكامل in women, but you can depend on it in men. So diagnosis can be done by a gram smear in men, while not solely in women. solely يعني بالكامل. شو بنعمل إذا ما نعتمد الجرام ستين؟ We do culture. Samples in men, we take urethral exudate or scraping, مسحة من الurethra. From women, cervical swab is better than vaginal or urethral, and better yield with anal canal culture. Culture, you culture it very rapidly، يعني ما تتأخر بالكلتشر. شوفوا هاي نقطة مهمة، وعادة في المستشفيات وفي الردهات المستشفيات نقع فيها. ناخذ المسحة وتبقى عند النير ساعتين ثلاث، يلا اتصل المختبر. If you are suspecting gonorrhea, you should culture it immediately or promptly, maximally within 15 minutes. فإذا احنا مرات شو نساوي؟ نطلب البليتس إلى ردهة المريض ونعمل الكلتشر في الردهة. So it should be cultured promptly and should be put in 5 to 10% CO2. As I said, is fastidious. Fastidious شو معناته؟ Require nutrients. This microorganism, remember, oxidase positive. I repeat this again. This microorganism is oxidase positive. يعني احنا من نشوف كولوني عندنا فلتر بيبر تبع الاكسوديس، ناخذ بارت من الكولوني نحطه على الفلتر بيبر تبع الاكسيديز تيست، إذا positive هاي نيسيريا gonorrhea. حكيت fastidious. The best media is called Thayer-Martin media. الطبق الذي نزرع عليه اسمه Thayer-Martin. راح أشوفكم صورة له. Which contain 5% of sheep RBC. S هذه شو معنات الاس؟ sheep RBC. ماخذين RBC من الشيب. شوكليت ايجار هذا يحتوي على شيب RBC بلس انتيبايوتكس. شو هي الانتيبايوتكس؟ هاي هي الانتيبايوتكس: vancomycin, كوليستين, نستاتين, which will inhibit other microbes including non-pathogenic Neisseria. Also, we can do biochemical tests and serological tests to speciate نعرف السبيشيز هل هي gonorrhea ولا مو gonorrhea. Biochemical and serological tests to speciate. شو معنى to speciate? To know the species of the Neisseria. This is selective media, Thayer-Martin. As I said, contain sheep RBC and antibiotics. And these are the colonies, you can look at them. And these antibiotics will make the medium selective for Neisseria gonorrhea. Chocolate agar, you can see the smooth colonies, convex, translucent, 1 millimeter in diameter. This is magnification of the colonies. أنا شفتها وترددت ما أعرف هذه شو هي الكولوني هاي. ستاف لو مو ستاف لو نايسيريا. أعمل أوكسيديز تيست. إذا بوزيتيف نايسيريا جونوريا. أوكي؟ إذا نيجاتيف أروح باتجاه الستاف مثلا. Direct detection, immunoassay, nucleic acid amplification test for genital and urine samples. Diagnostic طبعا هذه يعني PCR مثلا. Confirmed by culture. Also, when you do nucleic acid amplification test, you should also test for chlamydia trachomatis, for example. We said they come together. And these tests can be used for screening also. Serology, neither sensitive nor specific. شو معناته serology؟ ندور على antibodies. مو specific ولا sensitive. غير مفيدة. فإذا إما نعمل direct أو culture أو نعمل هذه الفحوصات الجديدة اللي هي nucleic acid amplification test like PCR وculture. Treatment, the best treatment previously was penicillin. And there is increasing in the MIC dose up to 8 microgram per ml. يعني because of the problem of resistance. يعني الميكروorganism it becomes resistant to penicillin بحيث أنه ال MIC can reach up to 8 microgram per ml وهذا رقم عالي بال MIC. فإذا الميكروorganism resistant للبنسلين شو ساوي؟ You can use third generation cephalosporin like what? Ceftriaxone, intramuscular injection. You should not use oral antibiotics. Always use injection because it is very acute, very severe, and it may progress to complication. Also, you have to treat for chlamydia, as we mentioned previously, azithromycin or doxycycline. How we prevent? Wearing condoms and also hygiene, and unfortunately there is no vaccine. Any question? Any question, Shabab? If no questions, I hope to you all the best. You finished your microbiology, you finished your systems, okay? And I hope to you all the best, the success in the exam, and hope to see you next year at the clinical site. بالتوفيق إن شاء الله. السلام عليكم.